Here are some of the major developments we're tracking right now. Confirmed coronavirus cases around the globe closing in on 13 million. 3.3 million here at home as more than 1 million Americans now recover. With me to start things off is ABC Chief Medical Correspondent Dr. Jen Ashton. And Dr. Jen, unfortunately, we are seeing cases rise significantly around this country. But as we're watching this, we're also getting more information about the virus, how it spreads, and our immunity. And that wasn't necessarily great news to hear today.
Right. And we have to take this with a chunk of salt because, as you said, we're learning minute by minute, day by day. But you can't talk about cases rising and people recovering without factoring in immunity. So here's what we know right now. After infection with any virus, just some mini med school, the body produces an immune response. This is our antibody levels. After SARS-CoV-2, no different. These IgG antibodies are made based on Chinese published data, and there's more data coming in literally every week. These antibodies, unfortunately, seem to fade pretty quickly within as early as 2 to 3 months. This obviously has implications clinically, societally, behaviorally for reinfection, for the utility and durability of a vaccine, and also for the ability for someone to be reinfected. So people saying, I tested positive for antibodies, I'm good, not so fast.
Not so
right
much.
now.
And, you know, we've seen such a wide range in symptoms, and you say that it shows, some of this published work shows that there is a big difference in immunity based on how sick someone was.
Exactly. And this is a perfect example in medicine, Amy, of how even the same disease is not one size fits all. So we know that up to about 50% of people infected can show no symptoms. Recent data now on this immune protection suggests that antibodies in people who had no symptoms reach lower levels and they fade more rapidly than people with more severe symptoms. If these antibodies levels fade, obviously this concept of herd immunity could be difficult, if not impossible, to achieve. Just a reminder, herd immunity requires anywhere from 50, 60 to 70% of the population to be permanently immune, either via natural infection or vaccination, or at least for a time being, and that obviously is in question.
Yeah, it doesn't look like anybody right now is permanently immune.
No.
All right, so research obviously going on around this issue. What's left to learn?
Well, what we still need to figure out when you talk about long-term protection against COVID-19, number one, the range in time. Does this immune protection last 3 months, 6 months, 12 months, as with other coronaviruses? We need to understand better the differences between people who have been infected without symptoms and people who had symptoms on that spectrum of severity. We also need to remember that it's not just antibodies that protect us. There are other immune factors like T cells at play. We need to understand that better. And we definitely need to understand the differences between vaccine immunity versus natural infection and how they differ. They're not the same. So a lot still left to learn, and this virus is challenging us every step of the way.
It certainly is. All right, Dr. Jen, thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.